So sign the buttocks. To get to this point in our lower quarter screening exam, we would have determined that there's limitation in range of motion of the hip, hip flexion, internal rotation. So we're going to use this test to rule out if the hamstrings are causing this or if it is the hip joint itself. So to do the sign of the buttocks, we're going to have the patient lie on their back, supine, and then I'm going to lift their legs straight up, and there's going to be resistance from that 30 to 70 degree range. At this point, when I start to feel resistance, I'm going to put a slight bend in the knee, keeping that hip joint in a neutral position. And then from here, I'm just going to apply a pressure into hip flexion. With the sign of the buttocks, I will still feel a resistance in hip flexion, and there might be pain in the hip joint. That is a positive sign that there is something going on in the hip joint itself, and the hamstrings are not what is restricting hip flexion.